Hey everybody, my name is Michele Desser. I'm a certified athletic trainer and the director of education at Functional Movement Systems. And what really drew me into Functional Movement Systems from the very beginning was simply that it's a multidisciplinary company. I was sitting in a room in my first course with people from all sorts of different professions, all coming together to really learn the same language and to be on the same page as we work through a diagnostic process. Now, my first course was the Selective Functional Movement Assessment, or the SFMA. So I was surrounded by healthcare professionals from all different disciplines. But the same thing occurs in the FMS, the functional movement screen. So it is just a cool opportunity for everybody from different professions come together and really just share their insights and really just share their education. And that's how functional movement systems was built. It didn't come just from the physical therapy world. It didn't come from just the chiropractic or the personal training, the strength and conditioning. It was a marrying of all those professions so that we could find the best standard operating procedure for all professions. So we're all getting to the same area. That artistry comes in with your professional training. What you do with that information, that's where your professional training comes in. I'm so honored today to be joined by Dr. Jason Hugh. He's one of our SFMA instructors and just such an advocate for continuing education in the whole, but functional movement systems. So, Jason, it's such a pleasure to have you here with us today.
Michele, the honor is all mine. Thank you so much for having me on today.
And firstly, a huge congratulations on being named the 2020 Chiropractor of the Year by the Tennessee Chiropractic Association. What a huge honor. And I mean, just tell us a little bit about that. What did that feel like?
It was a ginormous shock, actually. I didn't even know I was in the running at first. And then once they announced it, our whole team was just blown away. It was an incredible honor in our state. We have some great evidence-based providers in Tennessee. So to be able to be nominated and then actually win 2020 Chiropractor of the Year was just a huge honor. And I just think it's great from a decade of just working really hard. Sometimes it's nice to have that recognition. So it makes my heart pretty happy.
Well, it's very well deserved. I mean, I've known you for a few years now, and I'm always inspired by hanging out with you and, the continuous learning back and forth. So, very, very well deserved for you and your entire team. And speaking of your team, so let's talk about a little bit about where you are. You're in Hendersonville, Tennessee, correct?
Yes. So we're about 15 minutes north of Nashville.
Perfect. And you own a facility called Active Spine and Joint Center. How long have you been operating that facility, and how did that all come about?
Yeah. So a wild story. So we've had the business now for 12 years, but how this all started was a karate tournament that I was in. I thought I was, head honcho and going to win this tournament. And I was 17 years old in the black belt division. And I came in there arrogant. I have one good technique that I was good at, but I was not a good athlete. And I basically just was a one trick pony. So I kept using my one technique. I would score a lot of points, win a lot of tournaments. But on my seventh tournament, I got a little arrogant. And in the very first round, I just got decimated. And I had a horrible rib injury. And the rib injury just led me around from provider to provider looking for relief. And in the end, I got referred to a chiropractor. And that was the first time I was able to take a deep breath in again after treatment. And I knew that minute, this is what I wanted to do. So I knew I wanted to have a sports background and be able to keep people active. So I chose Logan and St. Louis because of their multidisciplinary influence in the region, and went to Logan, had a great experience there with a lot of great rehab evidence informed providers, and then came back to my hometown because I wanted to change that culture of just referrals. I wanted to be highly involved with the athletic trainers. I knew that we had a lot to be able to offer to athletes, but I didn't know how to form those relationships. So I went back home because I wanted to see Nashville level up in those ways. And very fortunate to be able to say that 12 years in, we've now established all those relationships. We're a go-to resource for many orthos in our region, as well as primary care physicians and athletic trainers. So 12 years ago, we opened the business. And recently, about 6 years ago, we bought our big facility. So now it's 6,000 square feet, where we can focus and live out our entire SFMA model in the business and still be able to get people to train heavy and lift heavy, et cetera.
Also, and Jason, I've heard you say multiple times that, the goal of your practice is really to treat each person as an individual, right? Every individual is unique. And I felt like when I first took the SFMA that really enlightened that for me, where it made me step back and say, this person isn't just a shoulder pain, this person isn't just low back. Can you talk about a little bit how you implemented the SFMA into your chiropractic practice and where it really kind of fits?
Yes, it's really been a journey. So when we first started, it was, I guess let's talk about briefly to answer that is how I found the SFMA. So I had a lot of rehab background coming out of school, and I'll never forget this one case that came in. His name was Tony. He had acute low back pain. He came in, and our whole thing was treat function, not chase pain. That was our model coming out of school back in 2008, 2009. And so I felt really great about that. So the patient came in, had low back pain. I treated him. By second or third visit, he's giving me a big hug saying, "Oh my gosh, I'm 100% better. I'm cured. Thank you so much for everything you did." And I said, "Oh, Tony, that's awesome. Yeah, you're out of here. High five. See ya." Fast forward a week later, I'm in Publix and I'm walking past the cereal aisle and I see him picking up a Tony's leaning over, but how he's leaning is barely leaning at all. And he's keeping his back very, very rigid, deep knee bending to pick up the box of Lucky Charms. And I remember seeing him saying, "Oh my goodness, like what have I done?" What I ended up doing was just helping treat the initial inflammatory pain. He thought he was better. And I realized we were doing this with a whole lot of cases. And so I saw that I knew we had to do something better to be more systematic. And I saw that Greg Rose was actually down at the Andrews Clinic in Birmingham doing a course in 2009. And I said, "You know what? I want to head down there anyway, see what the area is like, and this opportunity to go see an SFMA course." And when I walked in there and then when I walked out, I was just completely a different person. It was everything that I knew, but I knew where my pieces started to fit finally. It finally started to click. And that was super exciting because now I had the most minimum number of movements that we could possibly do to get a full assessment of an individualized patient. And so what we started to see is like, how do we scale this in chiropractic though? Because the business models, are a little bit different. It's a lower margin business. You got to be really efficient. And what we found was, we started doing a lot of video analysis with these to be able to record our top tiers and then be able to train our therapy assistants to be able to help us with that. So that's where it fits for us. It's part of every single visit. If it's medically safe for them to perform the movements, we do that at initial exam, re-exam, et cetera, et cetera.
You mentioned, you had graduated from Logan, and, I know you know this, but the SFMA is actually integrated into the Logan curriculum right now. Don't you wish you could go back and get exposed to it in school? I'm so jealous of
Oh
students
my
coming out of
gosh.
curriculum now because I wish I would have came out of school with
Unbelievable.
this information. And I think a common, thought process is, well, in regards to where the SFMA fits into everything is, oh my gosh, is this telling me I need to forget everything that I already learned in my diagnostic process? And that's a little bit of a misconception, right? There's a place and a time for the SFMA. I don't know if you have any thoughts on how you answer that question when people ask.
Yeah, it gets asked all the time. And I guess we've just been doing it so long that sometimes I even get caught up in my own way of thinking. But to us, it's very crucial, obviously, to still do our provocative testing. And that's always part of our discharge criteria to make sure that gets better. And we have to do a sound orthopedic and neurological assessment to rule in that they're a candidate for conservative care. So for us, it's definitely exactly like you said. It is not throw everything out. However, it is my favorite audit to be able to see with a patient that these are movements that, again, like we said, are simple to be able to test as many ranges as possible to then get down to the source of those movement problems. It's just such a great way to appraise regional interdependence. So when we use this, we will still use our other interventions that we would do with treatment, et cetera. But this is such a great audit to see if we're actually treating where we want to be and are we getting the results we want to get.
I love that aspect of the SFMAGs and the check the recheck, right? And it really just
Oh,
helps me see if I'm making a positive impact on the individual in front of me. And
yes.
sometimes some of the feedback we get, especially from that chiropractic side, because your caseload is a little bit different, perhaps than like the physical therapy side, where you're seeing more high volume and maybe a little bit less time with individuals. So the SFMA, especially when you first learn it, can be quite overwhelming because it does take a little bit of time to get through the process and the flow. But ultimately, from your standpoint in your facility, Integrating the SFMA, how does that work from a time standpoint? That first assessment, if you could just give us some indication on how you fit that in, basically.
Absolutely. So for us, it's went through several renditions. And I think that's what's so amazing about the SFMA is how scalable it is. The entire movement system, what gets me excited, makes me want to run through a wall literally every day, is the scalability. So no matter where you're at in practice, there's a way that you can pull this off and use it in a way that's going to give you valid information, a great test, retest. So for where we're at now, I do want to preface this that this is, 10 years in of us implementing it and then finding different levels of efficiency at different levels of scale of number of providers. So for example, when it was just myself and my wife as the only two employees of Active Spine Joint Center versus now where we have 9 employees, we have 3 docs and we have 4 therapist assistants and then a host of interns and students, the scalability is the key. So where we're at now is that when a patient comes in, they'll do their initial paperwork online at home. So our EMR allows us to do that. So we will have that and those checks and balances done already. And then when they come in, we've already screened their information and we send in a therapist assistant to start the process and make sure they're a candidate to go through with the movement exam right away. And then we start it right away. The SFMA is performed right away, the top tier. We record that on video, and then we go ahead and start with 1 or 2 breakouts right away. And then the provider enters the room, and then we pick it up from there.
That's a great model of how to implement this in. And it just goes back to reinforcing your thought process of that team aspect, right? Like
Absolutely.
bringing everybody in to be on the same page. And going back to what I said earlier, that multidisciplinary, we're all speaking the same language. And, for me, the SFMA was really, I stopped guessing, right? Like I stopped spending time on areas that really weren't probably affecting the overall problem. And, it really fine-tuned my ability to get to the most effective place the fastest, and sometimes
Yes.
I think that's overlooked because the SFMA, yes, can be overwhelming when you're first learning it. But as you practice it, just like with anything, you become more proficient and faster. And then your interventions are more targeted and faster, and you get better results. I get better results actually for my patients.
Absolutely.
So awesome.
Absolutely. Absolutely.
Now, Jason, I know that you've obviously invested a lot of time in figuring this out, and I know you take a lot of continuing education yourself. And from that, you've developed another company, a consulting company, Movement Consults, where you actually spend time helping individuals on the chiropractic side implement their standard operating procedure, for lack of a better word, right there. Do you mind talking about that a little bit?
Absolutely. This started out of what felt like necessity, meaning we were fielding so many questions about how to do this. But the hardest part at first, I thought we could do it very standardized. I thought that everybody could just implement it right away. But the key thing is there's a big difference between the student that's starting out and they're going to formulate their business model to begin with, and they're going to find a way to make that A, successful for their small business, but B, to be able to get exceptional results and change lives. So if you've already had an established business and you just now stumble upon the SFMA, which is exactly what I did when I started practice, I thought I had it all figured out, and then came across the SFMA and realized, oh my gosh, what have I been thinking? These great providers have come together and created such a great systematic approach to where we can apply it so quickly. Well, the key is I remember one of the first clinics that we helped step into. It was one provider. They had a few hands-on massage therapists and they had a couple therapist assistants, but it was one doc and they were seeing 200 patients a week.
Oh my Lord, that's a lot.
And when I talked to them, I was like, oh my gosh, they were like, we are having such a hard time getting all the breakouts in right away day one, because here's our patient volume. And it was like, oh no. So the way they were trying to implement it was just too much, too fast. So they had to get there one step at a time and put together an actual plan, a course of action to where everyone can level up together. And now they're able to do that way more successfully. But I think of it from a conversation I had with Phil Plisky really early on. He was talking about how crucial it is with patients that you have the end game in mind. Where's the discharge criteria that you're getting that patient to, so that you know that you're building them towards self-efficacy? Well, that's the same model that we would use to help implement somebody to be able to onboard, to be able to use these things. It's that, yes, we need to know what our end game is. Where do we want this to go? Where does this work for you from the business side? But also, how can you, without feeling like you're just blowing up every system that you have, to be able to start implementing these great movement assessment strategies? And so that one step at a time approach, and be able to speak the language with them of knowing where they're coming from in their initial background, I think being able to speed them through that as opposed to stumbling for 5, 6 years, to be able to do that in a few months is a much better route.
Oh man, I couldn't agree. And a lot of times when I'm using the SFMA and I find something and I go and I do my local exam, I intervene and whatnot, and then I retest. And yes, I'm not perfect. Sometimes things don't change. It's my really quick thing going, well, maybe that's not the driving thing. Maybe I need to look at something else, the bigger picture. So for that checks in that balance and really keeping you on that targeted path to, like you just mentioned, the end game of getting them out of seeing you, getting them back to what they love doing and back to their activities.
Yes,
Really the SFMA helps me. And then bringing the FMS in and even the YBT, the entire, functional movement systems has really helped me fine tune that process right there.
absolutely.
Jason, any words of wisdom you'd like to give, especially from the chiropractic side, individuals who are thinking about taking the SFMA, haven't quite gotten there yet, anything, or those actually chiropractors who have taken it, any words of wisdom you'd like to share with those folks?
Absolutely. I think the biggest thing is if the initial hangup is if you've already taken the course and you were just like, oh, it's just too much. I would like you to revisit your strategy of how you approached implementing. So, meaning my favorite way is to start with one pattern breakout at a time and get really proficient at that over a couple of weeks, get your reps in, and then start building one pattern at a time. Start with the biggest one that you feel like the biggest movement that's not painful, that you're going to get some great information, and start applying that and keep your same interventions and do your same treatments, but just see how the patterns change. And I think you'll be pleasantly surprised that a lot of times you see some great changes, but then sometimes you're going to be humbled that maybe they don't change, or maybe it's a case where they're that uncontrolled hypermobility and you think, oh man, they're really joint restricted here, et cetera. And then you treat them and realize maybe we're not where we want to be. So we realize, oh my gosh, that's when our motor control based rehab is going to be life-changing for them, and you know how to start that right away as opposed to just hitting those points of frustration. So I think the biggest thing would be start one pattern at a time. And if you haven't been implementing it and these words seem like they're a little foreign, etc., I really implore you to spend some time, especially with the new all online plan, or come see us in person. It's just unbelievable how fun it is to be around like-minded clinicians that are all trying to level up and find the best ways to do a great movement assessment on our patients and to be able to just help them better.
Yeah, I mean, we always stress this enough, like the more movement you see, the faster you get at evaluating it, right? So, like you mentioned, coming to one of our courses, we try and give you as much hands-on practice as we possibly can to just see all the varied ways that people move through different patterns and how to quickly start to look at that and break it down. And so I couldn't agree with you more. Increase those repetitions and things get a lot easier. I think both of us could probably say we can get through the SFMA pretty quickly right now, but we've been doing it for years and we have a lot of repetitions under our belt. That doesn't just happen by taking the course one time. You really have to invest the time into really looking at movement.
Absolutely.
All right. So folks, if you want to learn more about, Jason and his consulting business and helping you implement this, you can visit movementconsults.com. There's more information on there on how to maybe get him to help you implement this into your chiropractic business. Jason, we are so thankful for you to spend some time with us today and just give us your insights. I can't wait to get back and see you in person sometime at a course. It's definitely been a long year of not being on the road with our instructor team. We're like a little family, right?
Absolutely. Can't wait. Can't wait. It's time. Let's
It's
open it back
time.
up.
It is time. But thanks again, Jason. We truly appreciate it. And as always, if there's anything we can ever do to help you, please don't hesitate to reach out at support@functionalmovement.com. We're always there to help you. Please don't hesitate. Until next time, see you soon, everybody.